A very warm and blissful morning to everyone. I welcome you all to the Faculty Development Program on Translating Evidence-Based Innovative Yoga Practices into Healthcare System. Organized by Department of Biotechnology and Bioengineering, School of Biosciences. And blissful morning to everyone. I welcome you all to the Department of Biotechnology and Bioengineering, School of Biosciences and Technology, in association with the School of Medical and Allied Sciences, School of Allied and Health Sciences, School of Education, and the Institution Innovation Council, Galgotia University. This event is organized to celebrate the International Day of Yoga 2025 under the signature event Some Yoga. Let us begin this divine journey by invoking the goddess of wisdom with Saraswati Vandana. Yoga is a symbol of balance, harmony, and inner peace. Let us all come together to celebrate this divine tradition, presenting the Yoga Geet by the Ministry of Ayush.
तन मन जीवन चलो सवारे युग मार्ग अपनाए वैर भय को त्याग सभी हम गीत मिलन के गाए तन मन जीवन चलो सवारे युग मार्ग अपनाए वैर भय को त्याग सभी हम गीत मिलन के गाए
आनंदमय हो जीवन सबका योग यही सिखलाए हो तनाव भय मुक्त सभी जन दिव्य प्रेम सरसाए
यम और नियम हमारे संबल सुखमय जगत बनाए आसन प्राणायाम ध्यान से शांति सब पाए
ऊर्जावान बने सब साधक संशय सभी मिटाए विश्व एक परिवार योग कर स्वर्ग घरा पर लाए
तन मन जीवन चलो सवारे योग मार्ग अपनाए वैर भय को त्याग सभी हम गीत मिलन के गाए
In recent year, the global healthcare landscape has recognized the growing burden of lifestyle-related disease and the urgent need of integrative preventive health strategy. In this context, yoga, a timeless science of holistic well-being, offer promising evidence-based solution for health promotion, disease prevention, and therapeutic care. This faculty development program on translating evidence-based innovative yoga practices into healthcare system will be held from 16 to 21st of the June 2025 is a step toward bridging the traditional wisdom and modern scientific inquiry. This program is designed to equip the educator, researcher, and practitioner with the scientific insight and applied framework for integrating yoga into the mainstream of the healthcare system. with an overwhelming response of 896 registration from across 700 academic and healthcare institutions. This faculty development program reflects an inspiring interest in blending the ancient practice with the contemporary healthcare need. The diverse participation, including PhD scholar, assistant professor, associate professor, tutors, professors, trainer, or non-teaching staff also underscore the interdisciplinary and pan-India relevance of this initiative. Across 6 transformative days, the program will feature keynote session, meditation practices, and expert-led discussion on therapeutic yoga application, mental health, epigenetic policy, integrative health model. This will be discussed in these 6 days. This initiative not only enhance the upcoming International Yoga Day, but also align the global vision of One Earth, One Health. To begin this session on an enlightening note, I would like to invite Professor S.K. Abdul Rahman, Dean of the School of Medical and Allied Sciences, whose contribution in integrating traditional healing practices with pharmaceutical science are truly commendable. Sir, we request you to share your valuable thoughts. Rahman, sir, over
Yes,
to you. Yes, sir.
yes. Am I audible, sir?
Yes, sir. You are absolutely audible. Sir.
Yes. So, very good morning to all. So, I am very happy to be a part of this FDP program, carrying out on translating evidence-based innovative yoga practices into healthcare system. So, this is the great theme was picked up by Dr. Gaurav Kumar and his team. So I congratulate Dr. Gaurav Kumar and his team. And as he is saying, more than 900 faculty members, they have registered under this FDP, 5 days FDP program. And I hope this program will give a connection between yoga practices and healthcare system. So there is a Dr. Gaurav has selected the eminent speakers throughout the India, and definitely these 5-day FDP program is going to be a wonderful event, and the faculty is also going to be so acquire the skills in terms of this yoga in relation with healthcare system, right? So advanced congratulations to the IIC of our Galgotias University, and thank you for inviting me to share my views in this mega event. Thank you, Dr. Gaurav Kumar, and
thank you, sir. Thank you so much, sir, for insightful address and for highlighting the importance of bridging ancient practice with modern medicine. We now request Professor Sagun Agarwal
उनका नेट क्लिक कर लो।
उनका ठीक है, हमारा नहीं होना चाहिए ऐसे।
School of Allied
We can't hear you.
Shagun sir, over to you.
Good morning, all. Welcome to Faculty Development Program onto the healthcare system. And Galgotia University is pioneering in the healthcare education is there. And nowadays we could find it out, a lot of non-communicable disease is in India. And you could find out a lot of portion of the diseases are the hypertension, diabetes, and your endocrine system is there. And we could find it out the way of treating is not the medicine. The way for treating this is your exercise therapy is there. And in our ancient system, it is the yoga is there through which we can cure all these disease. I am saying the word cure because nowadays a lot of researches has been done. If we go for the yogic practices, they can lower down your blood glucose level. They can control your hormonal levels, they can control your blood pressure. So I would say I was seeing the panel of the expertise in the FDP program, and they are from the renowned institutes, and they are having expertise in this. And through this faculty development program, definitely we would be able to find the ways to treat these diseases is there. I would like to thank our Galgotia's IIC team and especially Dr. Gaurav for taking this initiative. And I would like to congratulate all the team for wonderful efforts. Thank you all.
Thank you so much, sir, for your inspiring message and for emphasizing the critical role of allied science in a holistic health system. It is my pleasure to invite our Dean, School of Biosciences and Technology, Professor Abhimanyu Kumar Jha, whose dynamic leadership contribute to shape the academic vision of our school. Sir, we request you to address the audience. Over to you, sir.
Am I audible?
Yes, sir.
Well, a very good morning to all of you. And I can see there is a good number of participants, 162 right now. So we are going to have a good number of participants as well as good speakers throughout these 6 days. And these 6 days are going to be a sea of knowledge for all the participants, I can tell you all. And I would like to tell you that as per the initiative of our Honorable Prime Minister, Shri Narendra Modi ji, he said a thing a few years ago to promote yoga. He said, yoga se hi hoga. So that is very important. Yoga can do wonderfully well in all realms of life. And yoga can make you fit. Yoga can make you the best personality. Yoga can bring out the best from you. And let me tell you one thing, as Dr. Shagun told about non-communicable diseases, there are many communicable and non-communicable diseases against which yoga can prevent us from being kind of victim of those diseases. And I can tell you that if you keep on at least doing yoga for at least half an hour every day, that is going to keep you fit and that is going to keep diseases away from you. So that's why this FDP is a contemporary theme which is going to be there for the next 6 days. And 21st June, as you all know, that is the yoga day. So that will be the culmination of this FDP, and that will be the final day of this FDP. And I would like to congratulate the whole team, especially our management, our Chancellor sir, CEO sir, under whose vision we are performing excellently well in every aspect, and we are again and again doing and repeating good acts like these FDPs, workshops, seminars, conferences, and so on. And in addition to that, I would like to, highlight the vision of our Honorable VC sir, as well as the other people involved in this conference. And I would like to tell you that Dr. Gaurav has really worked hard for this. And the day the VC sir called us and told that we would like to go ahead something on yoga, and we would like to go ahead with some workshop or FDP. I thought that Dr. Gaurav would be the right person to go ahead with it. And we have been lucky to have with us the School of Allied Health Sciences as well as the School of Medical Sciences as well. That's why this FDP has been planned with DBBE, School of Biosciences and Technology, and SMAS as well as SAHS. So it has been a combined effort of all the three schools. And from our school, DBBE is leading this initiative. And Dr. Gaurav and his team is performing reasonably well. I'm sure that this is going to be a very good sea of knowledge for all of you. This is going to be a good mix of enlightening talks, good mix of enlightening and informative knowledge, and that is going to boost your health as well as fitness across the whole year, across the life. That's it, and I would like to wish all the best to all the participants from various universities across the country, and all the best to all the speakers as well as all the people involved in this FDP, along with the whole team of SBT, SMAS, and SAHS. Especially Dr. Gaurav and DBBE, they have been doing reasonably well, performing very well since last few days. And there is a good range of speakers as we are going to see in these coming 6 days. Thank you. Thanks a lot.
Thank you so much, sir, for your inspiring thoughts and for always motivating us to pursue the excellence in biosciences and beyond. Now, to conclude the inaugural session, I request Dr. Sumedha Mukherjee, ma'am, our event coordinator, to propose the vote of thanks.
यहाँ पे चाय मिलती है किसी कुछ नहीं
Good morning, everyone.
मिला
नहीं है। आ जाओ यहाँ पे आ जाओ।
Good morning, everyone. Good morning, everyone.
Good morning.
I am truly delighted today to be the person who have been nominated for giving the vote of thanks for in the beginning of this wonderful session for yoga. As our Dean Sir correctly said that our Prime Minister has once said that yoga se hoga. So yes, this is an FDP which binds together the traditional and ancient traditions of our India along with the modern contemporary sciences of medicine and biotechnology and life sciences. This is a FDP that will bind together all the aspects of mental and physical health. So to begin with, for culminating such an incredible experience and FDP on yoga, I would like to heartfully thank our Honorable Chancellor Sir and Honorable CEO Sir, Mr. Sunil Galgotia Sir and Dr. Dhruv Galgotia Sir, two visionary leaders under whose able leadership we have been doing all our events, and we have been culminating all such kind of excellent events. Next, I would like to thank our Vice Chancellor, Dr. K. Mallikarjuna Babu Sir, who is leading us through all kinds of events, and under his guidance, we have successfully made this event come possible. Next, I would like to thank our Dean, School of Biosciences and Technology, Dr. Abhimanyu Kumar Jha, who has always helped us and always been there for as a pillar of support for every kind of event and every possible problems that we have encountered, and always helped us go through it. I would also like to thank Dr. Shagun Agarwal and Dr. S.K. Abdur Rahman, Deans of School of Pharmacy and School of Allied Health Sciences, to provide the support to organize this wonderful event. Next, I would like to thank Dr. Gaurav Kumar, who is the chief coordinator of this event, who has been the master player in organizing all the roles and all the events of this particular FDP, and he has gathered the excellent speakers who will be making this FDP a true vision. So I would like to thank, lastly but not the least, our experienced speakers who will be taking us through this transformative journey for the next 6 days. And I welcome you all with my whole heart, and we thank you so much for taking time out of your busy schedule to accommodate this FDP within us, and to agree to share your knowledge with the participants from all over India. And lastly, our participants, thank you for joining us, and we hope this will be a really transformative experience of your life. And along with faculty development program, we will also be able to develop our mental and physical health. Now, with this, we formally begin this transformative journey of faculty development program. Thank you all once again for being here, and thank you really for participating in this wonderful event. We will now begin the technical sessions. Thank you. So we will begin our first technical session with the keynote talk by Professor Reema Dada on complex lifestyle diseases, role of yoga in health promotion, disease prevention, and management. Professor Reema Dada, we request you to kindly start your session.
Okay, thank you, ma'am. हाँ जी.
Ma'am, I will, you can take a little bit time. We will just let you know.
Okay. Should I share my slides?
We request Professor Rima Dada to kindly start her. We would now like to introduce Dr. Rima Dada, who is the Professor, Department of Anatomy at AIIMS, New Delhi. Dr. Rima Dada is MD, PhD and DSc and Professor and Faculty in charge of the Molecular Reproduction and Genetics Facility, Department of Anatomy at AIIMS, New Delhi. A leading expert in genetics and epigenetics, Dr. Dada's research focuses on how lifestyle choices influence the epigenome and contribute to complex lifestyle diseases. Her pioneering work explores the role of yoga as a powerful non-invasive intervention that impacts both the nuclear and mitochondrial genome. Today, she will shed light on how yoga can promote health, prevent disease, and modulate our internal biology for holistic well-being. A truly inspiring topic of research, completely integrating the ancient medicine with the current biological research. So, ma'am, we are keen to hear to you. We request you to kindly start your keynote talk. Thank you so much.
Thank you, ma'am. I'm just sharing my slides.
Yes, ma'am.
Can you see my slides?
Yes, ma'am. Yeah, the slides are visible.
Okay. Thank you so much for inviting me to this faculty development program under the Samyog, which is being organized because of the occasion of International Day of Yoga. I would like to thank Dr. Gaurav Kumar for inviting me, and also Dr. R.S. Sharma, who was the ex-Deputy Director General of ICMR and now a distinguished professor here in the Galgotia University. Thank you so much. And I would be talking to you about lifestyle diseases. They are complex diseases and how yoga plays a role in health promotion, disease prevention, and management. Just 1 minute. Yeah. So what are complex lifestyle diseases? These are diseases which are also known as non-communicable diseases, and there has been a huge increase in the incidence of these lifestyle diseases. They are said to be complex because they occur due to an interaction which is highly complex, which occurs between the genes and our environment. And in the recent decades, we have seen a phenomenal increase in the incidence of these lifestyle diseases. It's also important to understand that though we blame our genes for all our disease states, but the recent concept of epigenetics shows that we have a huge responsibility, that our habits actually determine our health and disease states. Epigenetics is the genetics of free will. And it's actually believed that whatever we do on a regular basis, what we adopt as our lifestyle actually determines our health and disease states. So during the course of this talk, I will tell you about how your lifestyle, habits, your thoughts, your diet, whatever you do, how it actually programs your genes and actually determines the way the genes behave. So if we adopt an unhealthy lifestyle, for example, if we have very frequently fast food, a diet rich in trans fats, salts and sugars, soft drinks, a calorie dense diet which is nutritionally depleted, or we have poor sleep hygiene, we are smoking tobacco or you consuming tobacco, high levels of psychological stress, all these habits actually switch on gene programs which are detrimental for health. They switch on genes which cause inflammation. Now, short periods of inflammation are good for us, but prolonged chronic low-grade inflammation sets the stage for various lifestyle diseases and also autoimmune diseases and in the end, cancer. But on the reverse side, I will show you that adopting a healthy lifestyle, for example, yoga is an art of living. It's just not what we practice on the mat, it's an entire lifestyle. The 8 limbs of yoga, the yama niyams, how you behave with your set of ethics, how you behave with others, how you practice non-violence of thought and action, how you a diet which is rich in whole plant-based foods. In addition to that, it is a minimally processed diet, such and you proper for good sleep hygiene. All these programs actually switch on gene expression of those genes and enhance gene expression of those genes which are helping to maintain mitochondrial and nuclear DNA integrity. They enhance the expression of DNA repair genes. They decrease the expression of genes which cause inflammation and oxidative stress. So it's very, very important to understand that these complex lifestyle diseases, it could be diabetes, it could be polycystic ovarian syndrome, unexplained male factor infertility, it could be coronary artery disease, it could be dementia or Alzheimer's, it could be any autoimmune disease like rheumatoid arthritis, or it could be or any cancer. These diseases have some common underlying etiological factors. And it is seen that in contemporary medicine, though it's the best for tackling infectious diseases, it is the best for tackling surgical emergencies, but for complex lifestyle diseases which occur due to our unhealthy lifestyle, our poor social habits, and unhealthy eating decisions, we see that they are best managed by a lifestyle intervention. So yoga is a mind-body energy medicine and which targets each of the underlying factors. Now, during the course of this talk, I will show you that it could be any of these diseases which I named, and I've been working on a few, and we've started work on a few more. I will show you that across all these diseases, there are some common underlying factors. Now, for those in modern medicine, you would need to take maybe 8 or 10 pills. But you will see that by practicing yoga, you can actually target each of those underlying factors. Here, I would also like to emphasize that yoga is not just complicated asanas. Yoga is a profound science and technology, which is India's greatest gift to the world. It's basically a spiritual, secular spiritual science. And it's important to understand that the effects that we see of yoga on our physical and mental health is just the side effect of this great science. It's also important to understand that when we practice yoga, it's a total lifestyle. It's an art of living. It's what we do on and off the mat. And as you will see through the course of this talk, yoga is going to actually show you how it switches on gene program by acting on our epigenome. So it actually modifies the expression of genes, and the effects of this are transgenerational. So what you do on a regular basis actually also switches on beneficial genes, especially from yoga, which can actually act on your germ cells, and this can result in transgenerational effects, which can decrease the incidence of genetic and epigenetic diseases in the next generation, and also result in the birth of a healthy offspring with a less burden of genetic and epigenetic diseases. So I've just talked to you about how yoga positively modulates the epigenome, and thereby yoga is not only playing a very important role in managing these complex lifestyle diseases, it also has a rehabilitative potential. But on the whole, yoga actually promotes health and well-being and is important for disease prevention. Now, according to the modern view of medicine, we are actually, what is health? It is the absence of disease. But as per yoga, it is actually to be yourself. And when you're yourself, you are at ease. So it's important to understand that our health is totally dependent on our choices. Whether we make bad choices, for example, we have a very disturbed sleep late, get up very late, we consume a lot of tobacco, alcohol, have highly processed food, or we just lead a sedentary lifestyle that would result in disease state. And so this is a landmark paper which actually showed that healthy living is the best revenge. And you can see that across the world, there's a globalization of this epidemic of lifestyle diseases. And this has basically occurred because we've shifted from a hunter-gatherer society to a society which is largely sedentary. We face this epidemic of obesity, which is now not just classified as a disorder, but actually a disease which is associated with a high incidence of a large number of cancers. And because of this change in lifestyle, we actually find that the diseases which used to set in at about 65, 70, 75 years are now affecting young children. Type 2 diabetes, which used to occur at about the third to fourth decade, is now occurring in children. And we can see that diabetes, blood pressure, cancer are actually on the rise. And you can see 2 in every 10 school children suffers from hypertension, and high intake of these sugary soft drinks, high intake of trans fats actually has resulted in a huge increase in the incidence of cancer. We are also seeing that our addiction to the internet, we are so digitally intoxicated, which also promotes children to just have a sedentary lifestyle and eat a lot of junk food. And it's been seen that 2 in 5 school kids have actually an unhealthy BMI. And also we see that a number of us are having a high intake of non-veg food. The WHO has already declared that red meat kills and processed meat kills faster, and yet we resort to having this. In addition to that, we find that 70% of urban India is overweight. 1 in 3 children are hardly able to even have any physical activity. And we find that though this population is obese, they are chronically hungry because they're having a diet which is calorie dense and nutritionally depleted. So this is a generation which is overfed and yet hungry. And this was a cartoon which I just recently saw on the net, but it is very applicable today, that our indulgence in our comforts is actually killing us. So Zomato and Swiggy don't want you to cook in your house. Ola and Uber don't want you to walk. And Zepto and Blinkit don't even want you to leave home. So this sedentary lifestyle, our overindulgence in comforts and having everything on our bedside, is actually the cause for huge increase in these lifestyle diseases. So one thing that we all dread is having cancer. And it's also a complex lifestyle diseases. Until date, we've been blaming our genes. But you can see that though there's been a huge increase in the incidence of cancer, and we blame our genes, but yet there are only 2 to 3% mutations which are highly penetrant, which are actually causing the cancer. Yet all the other cancers are because of environmental factors. And these environmental factors don't cause mutations. They actually cause epimutations and loss of epigenetic control, which actually results in dysregulated gene expression, overexpression of certain oncogenes, suppression of tumor suppressor genes. And you can see that an unhealthy diet, tobacco, alcohol consumption, and obesity are major issues which are the underlying factors for a huge increase in the incidence of cancers. So we see that our healthcare system is largely based on managing diseases. And who thrives on this? They are not promoting health and wellness. They are actually promoting just the management of diseases. And it's the pharma industry which actually thrives on this tsunami of epidemic diseases. And we can see that health spending actually has pushed so many people below the poverty line. And as doctors, though we are aware of these habits which actually result in these lifestyle diseases, but unfortunately, a large number of doctors are obese, 53% are diabetic, and 24% are hypertensive. So it could be any complex lifestyle disease. As I told you, it could be diabetes, polycystic ovarian syndrome, it could be depression, it could be an autoimmune disease or cancer. There are some common underlying etiological factors. These are high levels of stress, anxiety, depression, chronic inflammation, oxidative stress, shorter telomeres because of which we are aging faster. There is persistent activation of the hypothalamo-pituitary adrenal axis. We are constantly in the flight or fright mode. There is a disturbance of the gut microbiome. There is a dysregulated immune response, and there's dysregulated gene expression. And this results in complex lifestyle diseases. And this was a report by the Eat Lancet Commission of 2019, which clearly showed that unhealthy diet poses a greater risk to morbidity and mortality than does unsafe sex, alcohol, drug, and tobacco use combined. So today I would talk to you how this profound science of yoga impacts our health. So what is actually yoga? It's a set of 3 practices: physical, that is asanas, breathing, regulated breathing practices, which is pranayam, as well as dhyan, which is meditation, self-contemplation, and an enhanced state of awareness. It's important to understand that we just consider yoga to be synonymous with asanas, and that too complicated asanas, but it's important to understand that the main aim of yoga is just to do asanas so that the body comes into perfect alignment, and thereby we are able to breathe more effectively. And when we are able to do pranayam effectively, then we are able to get into a state of meditation or dhyan. Thus, the main aim of yoga is to achieve a state of meditation. And therefore, if you practice yoga on a regular basis, maybe for just 30 to 40 minutes in a day, you can see the profound effect that it has on your physical as well as your mental health. So now I'll just give you a few examples of the work that we've done on the effect of yoga on different lifestyle diseases. I begin with male factor infertility, and as you all know, this is a problem for which women are blamed. And we've been working on the genetic basis of male infertility. And now male infertility is also classified as a common complex lifestyle disease. And in approximately half the cases of infertility for which we blame the women, it's actually the male factor. And in the recent decades, there has been a very rapid decline in the male reproductive health. And this syndrome is known as testicular dysgenesis syndrome, where you have an increase in the genitourinary abnormalities, a decline in the sperm quality, and an increase in the incidence of certain testicular cancers. Now, normally when you do a semen analysis, we find there are cases which are having poor sperm quality. But when we talk of unexplained male factor infertility, these are cases which have normal count, normal morphology, normal motility. All their endocrinal parameters are normal. So as per WHO guidelines, they are actually having a normal sperm count, so they should be fertile. However, the studies done in our lab and now done also worldwide have clearly shown that even if there are men who have a picture where there is a normal count as compared to this picture where you have a low sperm count along with a large number of some sperms with morphological abnormalities, or you have a low sperm count with normal morphology, or you may not have sperm, it has been seen that this group of men who are showing this normal picture have high levels of seminal oxidative stress, and this sperm DNA harbors high level of damage. And what is the cause of that? The cause of that, again, is an unhealthy diet, which is high in processed food, a non-veg diet, a high intake of non-veg food, which is very rich in endocrine disrupting chemicals. Also, they lack fiber as well as they lack antioxidants. Smoking, excessive use of cell phone and exposure to electromagnetic radiation, alcohol consumption, high levels of stress, increase intake of fast food, sugary soft drinks, and exposure to micro nanoplastics, which are not only increasing our consumption of plastics, but in addition to that, they are coated with various factors which we also consume, and these are like phthalates and endocrine disrupting chemicals. So we see that because of these unhealthy lifestyle factors, be it urban or rural India, there is an increase in the number of cases of male factor infertility. And because of that, there is increased use of assisted conception. The number of childless couples are increasing, and there's a growing demand for couples to use this assisted conception, or that is a test tube babies. But it's important to understand that the more you use this technique in one generation, the more you would need it in the next generation. There are countries like in Denmark, and where 1 in every 30 child is a product of assisted conception. And when we have sperms with DNA damage, it actually results in children having twice as high risk of major birth defects, and there are also higher incidence of certain cancers. So these men who are infertile, and one of the main causes of people going in, though there are female factors, for example, blocked tubes or low number of oocyte count, but one of the major factors why couples resort to this intracytoplasmic sperm injection is poor quality sperm, and sperm DNA damage is the single largest cause of defective sperm function. So this defective sperm function occurs mainly due to our unhealthy lifestyle. This unhealthy lifestyle, for example, as I told you, all those factors, psychological stress, sedentary lifestyle, obesity, high intake of processed food, along with a delayed age of marriage and also further delaying the time when we think of having a child, actually causes damage to the sperm mitochondrial and nuclear DNA. This damage is oxidative in nature, and we can quantify the oxidative damage to the sperm DNA by quantifying the level of this base, which is 8-hydroxy-2-deoxyguanosine. It causes fragmentation of the mitochondrial and the nuclear DNA, and it causes shorter telomeres. So the sperm is aging faster. And when such sperms are used to fertilize the ova, it not only results in recurrent failure on assisted conception. So you are going in for a test tube babies, there are repeated failed attempts. But if they are able to fertilize, there could be spontaneous abortions, congenital malformations, increased incidence of childhood cancers, complex neuropsychiatric disorders like schizophrenia, autism, attention deficit hyperactivity disorders, and dominant genetic diseases. So you can see for all these problems, we always used to blame the mother. But now it's known that these problems are actually one of the major factors is because of defective sperm, which is harboring defective sperm DNA. So initially the concept was, and even now we know that when the mother is pregnant, if she has high levels of stress or unhealthy diet, it could result in, some diseases in the offspring. And that concept was known as developmental origin of health and disease. But now we know that it's the father's lifestyle, an unhealthy lifestyle after spermatogenesis begins at puberty. Each of those factors like high level of stress, doing drugs, high levels of, using your cell phone for very long periods, or consuming tobacco and alcohol actually leaves a mark on your sperm DNA and disrupts your epigenome, which has led to this concept of paternal origin of health and disease. So what do most couples do? So when they are planning to have a child, these couples start leading a healthy lifestyle. They have a plant-based diet, they start, doing meditation, but that's just for 2 to 3 months prior to that. However, these changes, these unhealthy habits have left a mark on their germ cells. If you practice a healthy lifestyle, it has been seen that you can change these epigenetic marks, but then you have to do it on a regular basis, because these changes, these marks on the epigenome are metastable. They are not like they have been set in ink. You can change them if you change your lifestyle. And now the recent concept is that biological parenting begins much before conception. It actually begins when parents themselves are conceived. So I would now talk to you how these factors affect development. So at the time of fertilization, the sperm is transferring not only DNA, but it transfers a large number of mRNA, microRNA, oocyte activation factors, centrioles, and all these factors are not only helping in fertilization, but they are determinants of embryonic viability as well as developmental competence. Now, what happens when sperm suffers damage due to environmental or lifestyle factors? It's important to understand that the sperm is the only cell in the body which cannot protect itself. This is because during development, the sperm sheds majority of its cytoplasm, so it also sheds majority of its antioxidants. Therefore, it has minimal antioxidant defense mechanism. It is very high in polyunsaturated fatty acids, which are targets of this oxidative attack. In addition to that, the sperm DNA becomes very compact so that it can travel in the female reproductive tract. But what happens because of this compact genome? 85% of the sperm DNA becomes transcriptionally and translationally silent. Therefore, majority of the sperm repair genes are now silent. So the sperm is actually dependent on the oocyte to correct its damage. In addition to that, in its periphery is the part of the sperm genome, which is about 15%, which is harboring the genes of the telomeric DNA and certain promoters of genes which are of key developmental importance, the ones which I just showed you, which are important for early development. Now, what happens? This peripheral part of the sperm DNA, because it's the open configuration of the DNA, is vulnerable to oxidative damage. And initially, we used to just believe that the sperm tends to accumulate damage because the male germ cell keeps on dividing. But this is a landmark paper by a laureate professor, R. John Atkin, which has clearly shown that our unhealthy lifestyle results in oxidative stress. And this actually damages certain areas which are known as mutation hotspots. And there are 9,000 genomic regions which are vulnerable to oxidative damage. There is oxidative damage to the genome. And for example, there's a region on chromosome 15, and that has regions which are linked to male fertility. And when damaged, can result in male infertility, cancer, imprinting disorders, behavioral disorders like autism, bipolar disorder, and schizophrenia. So these factors are affecting embryonic development. Our studies have shown that a large percentage of men who are infertile, whether with primary or secondary infertility or with recurrent spontaneous, have high levels of oxidative stress. So we've quantified the levels of seminal free radical levels by using a luminometer. So to combat oxidative stress, the doctors actually recommend a high intake of fruits and vegetables. So a high intake of fruits and vegetables, WHO says that we should have about 5 servings, whereas the Physicians Committee for Responsible Medicine says that we have to have 10 servings because we live in a sea of free radicals. And not only that, we also find that a large number of these sperm transcripts are dysregulated and their levels are very different from that of the controls. And this can result in impaired embryonic development and recurrent pregnancy losses. So we quantified the level of damage in the sperm. We used 2 techniques. The first technique that we used was the comet assay. And you can see by comet assay, you can actually quantify the number of sperm which are having DNA damage because they have a long fluorescent tail. Now, these sperm have been stained, and you can see that as compared to the controls, where majority of the fluorescence is in the region only of the head, the sperm in the infertile men have damaged DNA and they have longer tails. In addition to that, we have also quantified the level of DNA damage using sperm chromatin structure assay. And here each dot represents the sperm DNA of each cell. And you can see that the number of cells which are towards the sperm, which are towards the x-axis, are the ones with the damaged DNA. And you can see in the infertile cases, the number of cells with the damaged DNA is much higher as compared to that in the controls. In the controls, you can see there are more cells towards the y-axis. So we were able to establish the cutoff levels beyond which a couple is able to conceive spontaneously and needs to resort to assisted conception. But we were also able to see that when they have DNA damage, they have an accumulation of this base 8-hydroxy-2-deoxyguanosine, which is a marker of oxidative stress. And this base actually causes mutations, which is actually resulting not only in infertility, but a higher incidence of cancer in these men, in these infertile men. But what's important, we actually took a form of non-familial childhood cancer that was retinoblastoma. Now, this is a cancer of the retina, and it's been associated with poor sperm DNA quality. So when we studied children who had developed this non-familial cancer, that means they had no positive family history of cancer. And when we looked at the sperm DNA quality of their fathers, we found that they have high levels of oxidative DNA damage. And this is passed on to the offspring. And usually we find this is the last born child when the father's age is also higher. And therefore, the oxidative damage accumulated is high and it overwhelms the oocytes repair mechanism. And therefore, you find that this base has passed on to the offspring, which is found in high levels in these children with retinoblastoma. And this is resulting in mutations and epimutations in the offspring. So what is the cause? It is unhealthy lifestyle, for example, tobacco smoking, alcohol consumption. And you can see that in this study, we found that normally retinoblastoma occurs due to mutations only in the RB gene, which is the retinoblastoma gene. But when you have oxidative damage, accumulation of this base, which is causing mutations and epimutations, we found that a large number of other genes were involved as well, which were causing, for example, which were the other tumor suppressor genes, cell cycle checkpoint regulator genes, and the repair genes. We've also correlated this damage with increased incidence of autism in children, because we see that there is dysregulated expression of genes and there's differential methylation of genes which are involved in developmental processes of neurons, synapse formation, and sensory motor conduction. So what does the doctor do when you have high levels of oxidative stress and DNA damage? The doctor actually prescribes antioxidants. And these antioxidants, though they can improve the sperm motility, but it has little or no effect on the DNA quality because the sperm DNA is so compact, crystalline, toroid. It's important to understand that there have been several meta-analyses and there are conflicting results and several controversies regarding the effect of these antioxidants on the nuclear DNA because it is highly compact. And now I'll show you how practice of yoga can impact the sperm genome and epigenome. So when you practice yoga, not only is there an improvement in the sperm motility, sperm morphology, and their fertilizing capacity, but we also see that there is an increase in the total antioxidant capacity. Now, this total antioxidant capacity, for doing this, increasing the antioxidant levels, one has to take high intake of fruits and vegetables. And these results are independent of this intake of fruits and vegetables. And we find that the group that practiced yoga, they had a significant increased expression of the total antioxidant capacity as compared to the group that did not have. And why does the total antioxidant capacity increase? The total antioxidant capacity increases because you're actually, there is hypomethylation of the genes coding for the antioxidants, because of which their expression level increases. In addition to that, we also find that, as I showed you, that when there is oxidative damage to the DNA, there are shorter telomeres. And when there are shorter telomeres in the sperm, it impairs cleavage forced fertilization. And cleavage length and the telomeric length is a complex trait which is inherited by the offspring. So shorter telomeres, if they are inherited by the offspring, not only impairs cleavage blastocyst development, but it can also result in early aging in the offspring. And telomeric length, being a complex trait, is basically determined by two main factors: the level of telomerase activity, which is a reverse transcriptase, which adds these hexameric repeats to the ends of the DNA, but it is also determined by the levels of free radicals. And as I showed you, since the oxidative stress goes down because of the increase in the total antioxidant capacity, therefore the telomeric length is maintained, because you can see that the telomerase activity actually shows a significant increase by practicing yoga. It's not only an increase in the level, but there's also increase in the telomerase activity. In addition to that, as I showed you, that there is little change in the oxidative damage when you take antioxidants, but when you practice yoga, you can actually show, it shows a significant decline in the levels of this base, which causes both de novo germline mutations and epimutations. It also causes post-zygotic mutations. So it's very, very important to understand that if we practice yoga on a regular basis, you can decrease the level of oxidative damage to your sperm DNA, and this can reduce the load of genetic and epigenetic diseases in the offspring. In addition to that, I had shown you that in infertile men, the levels of the mRNA were also altered. So you can see pre-yoga, the levels are this. In normal fertile men, the level is this in the controls. And you can see with practice of yoga, the levels have started normalizing. In addition to that, the poly-ATP ribose polymerase, which detects the DNA damage, whose levels are low in infertile men, they show a 3.4-fold increase. And this gene, which is helping to re-establish the methylation marks also shows a significant increase. With oxidative stress, I told you there is hypomethylation of the sperm DNA. Now, when the genome becomes hypomethylated, it becomes unstable because of unmasking of the repetitive elements, which can result in complex chromosomal translocations. So what happens with practice of yoga? The oxidative stress goes down, because of which the oxidative product of methyl cytosine, which is 5-hydroxymethylcytosine, its levels go down, whereas 5-methyl cytosine levels shows a significant increase post practice of yoga. This is very important because this helps to re-establish the methylation marks. And this was the first study which has also shown that what is the effect of yoga on the sperm methylome. And we can see that there were about 442 areas which showed differential methylation, and number of genes which are helping in embryo implantation, spermatogenesis, helping to maintain the telomeres and enhance repair, shows a significant hypomethylation and thus enhanced expression. Apart from the effect on the nuclear DNA, we can also see that yoga practice actually increases your mitochondrial integrity. This can be seen by an increase in the mitochondrial membrane potential, which has gone up from 53.9 to 89%. And you can see that there is a over regular practice of yoga results in a significant increase in the improvement in the mitochondrial integrity. And this occurs because of an enhanced expression of genes which are helping in maintenance of mitochondrial integrity. Also, the NAD levels, which are helping to maintain the mitochondrial and the nuclear DNA crosstalk, its levels increase post practice of yoga. In addition to that, we also studied the DNA quality. As I had shown you that these are men who have high levels of DNA damage, more sperm towards the x-axis. You can see with practice of yoga, the number of sperm towards the y-axis actually increases in these men. The most important thing to know is that your oxidative stress and the changes in your epigenome are very rapid. Oxidative stress goes down within 10 to 21 days. Epigenetic changes are very dynamic. However, it takes about 6 months of regular practice of yoga, about 30 to 40 minutes daily, to show significant improvements in the DNA quality. But it's very important because yoga not only is improving your mitochondrial DNA integrity, but also your nuclear DNA integrity. And decline in mitochondria actually results in oxidative stress, damaging the nuclear DNA. So, and when there are dysfunctional mitochondria, it actually results in early aging because of oxidative stress. So, yoga can help in decreasing the rate of testicular aging. Now, infertile men are also having a higher predisposition of developing cancers. So what we did was, this is a new study we initiated, and though I've just got a few slides to talk about it, but we've done it in great detail, where we've taken the serum of infertile men who were practicing yoga and treated hormone-dependent and hormone-independent cell lines with yoga-primed serum. And we find that with practice of yoga, the number of cells showing apoptosis is significantly enhanced in the group that practice yoga. So from this, the take-home message is this, that so far from this study, we can see that germ cells are highly vulnerable to environmental and unhealthy lifestyle factors, and practice of yoga, which is a mind-body integrated approach, a holistic method which helps to manage both the mind and the body, improves both the nuclear and the mitochondrial DNA integrity. It positively modulates the epigenome and thereby can reduce the incidence of unexplained male factor infertility and decrease the burden of genetic and epigenetic diseases in the offspring. Now I'll talk of polycystic ovarian syndrome. Now, polycystic ovarian syndrome is a complex endocrinopathy. It's a heterogeneous complex endocrinopathy, and it is though believed to be primarily a defect of ovarian dysfunction, but now we know that it is basically a systemic defect and a metabolic disorder. And if not treated on time, it is associated with a very highly increased risk of type 2 diabetes, coronary artery disease, cardiovascular disease, hypertension, fatty liver disease, Alzheimer's, and ovarian and endometrial cancer. Now, polycystic ovarian syndrome has increased significantly both in rural and urban India. The main reason being a sedentary lifestyle, a diet which is highly rich in processed food, and high levels of stress. So it's again a complex disease. The genes and environment both play a role, and it is actually having some common abnormalities. It is associated with hyperandrogenism. It is associated with ovarian dysfunction, which results in oligo or anovulation, menstrual irregularities, cysts in the ovaries, hyperinsulinemia, and hyperinsulinemia and high levels of androgens. So I will show you again that these, be it PCOS, be it infertility, there are some common factors and how it can be best managed by yoga. So in polycystic ovarian syndrome, you have arrested development of the follicles. There is high levels of anti-Mullerian hormone. And because this inhibits FSH, it inhibits the conversion of androgens to estrogens. So the androgens levels increase. There is hyperandrogenism. There is increase in the insulin growth factor and hyperinsulinemia. And there is arrested development of the follicles beyond the antral stages. And so in addition to that, you find that the granulosa cells are affected, and this defect is central to the pathophysiology of PCOS, and there are extra-ovarian modulators that disrupt intra-ovarian regulation of steroidogenesis. And over a period of time, you can see that it affects different systems, and there are different disorders, diseases which are occurring at different time points. But besides being a central ovarian defect, it is also associated with a dysregulated immune response, mitochondrial dysfunction, oxidative stress, insulin resistance, shorter telomeres, and metabolic changes. So we have got cases, the inclusion criteria for the cases which were referred to us from the Department of Obstetrics and Gynecology were young girls who were not on any treatment of contemporary medicine. So these girls were just told to adopt yoga into their lifestyle. And when they had two of these three factors, they were classified by Rotterdam's criteria, and they were classified as PCOS and referred to us. So these are some of our patients practicing yoga. And you can see that these are the results of this study, that post-practice of yoga, you actually find that in these women, there is a decrease in the body mass index. The FSH levels and LH levels, you find that the LH-FSH ratio is increased, and therefore you do not see that LH surge, which you should be seeing during ovulation. Their levels start normalizing. The testosterone levels decrease. The steroid hormone binding globulin, which is low, which is very important, thereby the free testosterone index is higher, actually shows an increase, and the anti-Mullerian hormones show a decline post-practice of yoga. And you can see that there is a decline in the severity of hirsutism, which is unwanted hair at unwanted places. You can see that in these cases with practice of yoga, there is a decrease in the severity of hirsutism. Not only that, there were studies which showed that oxidative stress plays a role, and we've seen again in these women a decline in the levels of reactive oxygen species, an increase in the total antioxidant capacity, and also an increase in the levels of melatonin. And this was very, very important because melatonin is playing a very important role, because not only is it a potent antioxidant which is found in mitochondria, which helps to improve the mitochondrial integrity, but it also helps to maintain the sleep-wake cycle. In addition to that, we also find that a large number of transcripts, the ones, for example, which are involved in carbohydrate and lipid glucose homeostasis, like PPAR gamma, whose levels are decreased pre-yoga, it increases. For example, this in insulin, this receptor whose expression level was lower, it actually enhances. We find that another key signaling molecule whose expression is lower increases. The level of inflammatory cytokines, TNF-alpha, which were higher, they show a decline post-practice of yoga. The genes maintaining mitochondrial integrity and oxidative phosphorylation, whose level is low pre-yoga, shows an increase. And again, the genes which are involved in ATP synthesis as well as in oxidative phosphorylation show an increase post-practice of yoga. We also see an increase in the levels of NAD, which are helping in maintain the mitochondrial and the nuclear DNA crosstalk. Cytochrome oxidase levels increase, the mitochondrial copy number increases, and the telomere length shows an increase post practice of yoga. Now, these girls who are having menstrual irregularities, at later age, they also develop infertility. They have high levels of, unwanted hair at unwanted places. In addition to that, they see number of acne and pimples are higher. They also suffer from depression and anxiety, which is also associated with higher levels of testosterone. And we find that post practice of yoga, the level of comorbid depression actually decreases in these girls. And the overall quality of life shows an improvement post practice of yoga. In addition to that, since these women are usually obese, even if they are not obese, it's seen that they have visceral adiposity, which is even more dangerous. We find that in these women, there is also post practice of yoga, there is an impact on their metabolome. So you can see that these are the metabolites which are seen in pink in the control cases, and pre-yoga, you can see the levels are here. So there's a marked difference between the levels that you can see post-practice, in these controls and the cases with PCOS. And with practice of yoga, we see that they have started moving, the levels have started decreasing, and the levels have started moving towards the levels of controls. So in addition to that, it's also important to understand, we quantify the levels of these metabolites. And just to show you, this is the level in controls. In PCOS is shown in green, and post practice of yoga, the levels of glucose, fructose has shown a decline. And so we have quantified a number of these metabolites. And doing a ROC curve analysis, we saw that there was a significant difference between these metabolites pre-post yoga intervention. So from this part till here, we can actually see that with practice of yoga, you can actually normalize your hormonal profile. The menstrual cycle becomes normal. A large number of women are able to conceive. There is the metabolite changes are there, which are important. There is hormonal balance. There's the dysregulated lipid profile shows an improvement. There's a decrease in the oxidative stress and inflammation, and improved mitochondrial functioning. And now I would talk of an autoimmune disorder, that is rheumatoid arthritis. Now, rheumatoid arthritis is a chronic, severe, progressive autoimmune disease which affects the joints. Now, it's very painful arthritis, and if left untreated, also targets the lung, the skin, the heart, the brain. And these are randomized control studies which have clearly shown that with regular practice of yoga, you can actually decrease the severity of the disease. You can decrease the severity of rheumatoid arthritis. And as you can see, the disease activity score shows a decline, and so the severity of depression. Now, there were two groups. Both the groups were on disease-modifying anti-rheumatic drugs, but the group that actually practiced yoga showed a much significant decline in the severity of the disease. So what is happening in autoimmune disease? There's a dysregulated immune response. There's high level of tumor necrosis factor, which causes an increase in NF-kappa B, which increases the levels of various inflammatory cytokines and the synoviocytes, and also activates the osteoclasts, which cause the bone erosion. But you can see that increase in the levels of inflammatory cytokine 17 causes the articular symptoms, whereas interleukin-6 causes the extra-articular symptoms. And you can see with practice of yoga, the levels show a significant decline. The levels of anti-inflammatory cytokines shows an increase. And the low levels of HLE is actually HLA-G. This is a non-classical HLA molecule, which actually causes an increase in the incidence of autoimmune disease, shows an increase because the levels are lower with certain insertion, deletion, polymorphisms, the levels increase. So it's important to understand that yoga helps to re-establish immunological tolerance by causing molecular remission. And we see that with practice of yoga, there's also an improvement in the there's a decrease. You can see in the level of several transcripts, inflammatory cytokines, NF-kappa B, TNF-alpha, and a number of these genes which are regulating immune response and causing hyperimmune response shows a decline. And the genes maintaining mitochondrial integrity show an improvement. And now I'll just talk of glaucoma, and I talk of primary open-angle glaucoma. Primary open-angle glaucoma is a condition in which, though the aqueous humor which drains through the iridiocorneal angle normally its flow is impaired, but in ombronangle glaucoma, the angle is open, but yet the intraocular pressure increases and damages the retinal ganglion cell. And now studies have shown that there are several factors which are operating beyond just the intraocular pressure, like there is hypoxia, there is oxidative stress, there is inflammation, there are decreased number of neurotrophic factors which are nourishing the neurons. There is reduced nitric oxide levels, because of which we find that these cases suffer from glaucoma. And when these cases practiced yoga, especially we focus them on doing Yog Nidra, Anulom Vilom, and Brahmari Pranayam, we see that there's increase in the expression of anti-inflammatory genes which are conferring neuroprotection and maintaining the trabecular meshwork, and the expression of inflammatory apoptotic genes actually goes down. I would like to emphasize again here, when you have high intraocular pressure, you should not be doing Kapalbhati or doing any forward bending postures where you bend below the level of the heart, because that will tend to increase your pressure. In addition to that, you also have high levels. It's been seen that with these cases have lower levels of blood flow in the visual cortex, and with practice of yoga, not only are factors which are promoting neuroplasticity are increasing, but there is also an enhanced brain oxygenation due to increased blood flow to the visual cortex. And now I'll talk of depression. Now, depression is India is believed to be the diabetic capital of the world, and India is believed to be one of the countries where one of the highest levels of depression, and we see large number of medical students having, committing suicide. Number of housewives have high levels of suicides. So we can see that it is a problem which has really increased and worsened with the COVID. And now we live in challenging times with war, with pandemics. This situation has worsened. And one of the major triggers is also an unhealthy lifestyle, because mental health is actually dependent also on your gut health. And a suboptimal nutrition is actually contributing to the epidemic of mental illness. Obesity, inflammatory bowel disease, depression, a cognitive decline, attention deficit hyperactivity disorders are all believed to be due to a highly processed and inflammatory diet, a diet which is calorie dense and rich in sugars. And again, a whole plant-based diet which nurtures the gut microbiome plays a vital role in maintaining the gut-brain health and gut-brain axis. So we did a randomized controlled trials where we took cases with major depressive disorders. And and we see that in gray are the group that practiced yoga, and you can see that there was a significant decline in the severity of depression in the group that practiced yoga. Now, why does that happen? This occurs because a number of factors which are promoting neuroplasticity. That means not only the brain is developing mechanisms, or there is increased neurogenesis in certain key areas of the brain so that it can respond to stressors. So till date, we were made to believe that the number of neurons are fixed, and once you age, the number of neurons keep on decreasing, and definitely the size of gray matter decreases. But people who do yoga and meditation regularly, you find that their brain aging slows. And these factors are promoting neuroplasticity. So they enhance brain concentration, it enhances your state of concentration, attention, learning, and memory. In addition to that, we also find that various feel-good factors, for example, a decrease in the levels of serotonin are associated with depression. And the most commonly sold drugs in the market are serotonin analogs, which are selective serotonin reuptake inhibitors, which are associated with numerous side effects. But with practice of yoga, you can actually naturally increase the levels of serotonin, and the melatonin levels increases because people who have depression, they have sleep-wake disturbances, poor sleep hygiene, insomnia that can improve post-practice of yoga. So it's important to understand that we do not need to wait to have certain disorders to start practicing yoga. If we all start practicing yoga, students start practicing yoga, they can increase their concentration, attention, learning, memory. They can be more mindfully aware and increase their emotional self-regulation and emotional resilience. In addition to that, depression is associated with accelerated aging and early onset of other lifestyle diseases. And this occurs because high stress and depression are associated with raised cortisol levels. and which is also results in oxidative stress. They're associated with lower levels of antioxidant capacity, which increases post-practice of yoga. And you can see that the telomere length is being maintained post-practice of yoga. And irrespective of the genotype, we find that with practice of yoga, the cases experiencing remission are much higher. In addition to that, a number of genes which are maintaining the genomic integrity, maintaining the inflammatory response, which have been down-regulated, they show an enhanced expression post-practice of yoga, and all 4 domains of quality of life show an improvement post-practice of yoga. In addition to that, as I told you, obesity has also reached epidemic proportions. It's really a disease associated with higher incidence of cancers, autoimmune diseases. We found that with practice of yoga, one of the major causes of obesity is emotional eating. The emotional eating decreases, and also your weight starts regulating, and there's a decline in the levels of inflammatory cytokines. In addition to that, we've recently completed a study on Alzheimer's, and this is to show you that with practice of yoga, there's an improvement in the quality of life of individuals with Alzheimer's disease, as well as there's reduced caregiver burden. And so it's important to understand that yoga is not only causing physical improvement in physical health. For example, in rheumatoid arthritis, it's causing molecular remission, your range of movements, flexibility in the joints increases, but it is also helping to improve your mental health. And now I just want to end by just telling you that we spend trillions of dollars in various products and research trying to, look younger, be younger, slow down the rate of aging. But even if we prolong our lifespan, if we do not enjoy a healthy lifespan, it's of no use. But we can see that with practice of yoga, you can not only prolong your lifespan, but because there is decrease in the levels of stress, cortisol levels decrease, there's a decrease in the level of inflammatory cytokines, the levels of feel-good hormones increases, the longevity gene expression increases, factors which are maintaining neuroplasticity since the levels increase. With yoga, you can not only improve your lifespan, but you can also prolong your health span. And therefore, your biological age can be much younger than your chronological age. And why do these changes occur with yoga? It's been seen that with regular practice of yoga, especially with nasal breathing and when you do pranayama, you actually stimulate various cortical and brainstem centers, and there's increase in the levels of alpha wakes, which cause relaxed wakefulness. In addition to that, with practice of certain pranayama like Anulom Vilom, Brahmari pranayama, you can actually increase the levels of nitric oxide, which improve circulation, blood flow, oxygenation, and then reduce inflammation. It's important to know with practice of yoga, you can actually bring about anatomical changes to your brain with increased neurogenesis and gray matter in the prefrontal cortex for executive functioning and memory, hippocampus, which is associated with memory, as well as areas like the parieto-temporal cortex, which are associated with empathy and compassion. So I would just like to end by telling you, so there are a large number of factors which are forming the etiological basis of any complex lifestyle disease. Diabetes, PCOS, male factor infertility, unexplained, autoimmune disease, or cancer. All these have some common factors, and by practicing yoga, you can tackle each of these factors. I showed you that through yoga, you can decrease your levels of stress, anxiety, depression. The gene expression gets regulated. You can regulate your blood flow. There is immune homeostasis. There is reduced apoptosis of certain cells which are critical, like the retinal ganglion cells. There is parasympathetic dominance, because of which there is increase in rest, digestion, and enhanced expression of repair genes. The telomere length is maintained, because of which you can slow down the rate of aging. There is decreased inflammation and decreased oxidative stress. So yoga is really an art of living, and it modulates the internal pharmacy by acting on the genome. So yoga is really a polypill. It has tremendous transformative power and causes dynamic changes in your gene expression. So yoga not only is ideal for the management of complex lifestyle diseases, but its integration with modern medicine would be very important, and it on the whole promotes health and prevents the onset of diseases. Thank you. Any questions?
So thank you very much, Professor Dada, for this insightful presentation. So I open the house for open discussion now. So if there are some questions, please feel free to come up. I see a question popped up from Sukesh Gupta. So yeah, so a question coming from Sukesh Gupta reads, thank you, ma'am, for the insightful session. So he asks, could poor sperm quality, especially DNA or epigenetic changes, affect fetal brain development and neuronal growth that may lead to Alzheimer's disease? And are there recent studies linking paternal factors to neurodevelopmental outcomes?
Yeah, that's a very good question. As I told you, there's this concept of paternal origin of health and disease, and there are several papers now which have clearly shown that fathers who eat junk food, paternal obesity, paternal smoking, paternal stress affects the development of the offspring's mental health. Just an example, there were studies done in a lab in US where they made the male mice smell cherries, the cherry blossom flowers, and then they gave them electric shock. Many generations downstream, when they were just made to smell those cherry blossoms again, the animals, the baby pups, shivered. That means that they had a memory through the experience of the father. So definitely the diet of the father, and it's not just what is happening at the time of conception, it's what he follows right when he himself is conceived, and especially when spermatogenesis begins at puberty, their diet, the levels of stress, the consumption of fast food, smoking, alcohol consumption, all are having a detrimental effect on the sperm, and these effects are transgenerational. So it's very important that these are the downside, but if you follow a healthy lifestyle, it would also improve the sperm DNA integrity. So that would be a plus.
So Mr. Sukesh Gupta, would you like to follow up? Okay. So yeah, Meenakshi Rathi ma'am, she has mentioned very informative and insightful. Shivam Kumar has expressed his thanks for this informative and insightful lecture. I see many people
There's a
are.
question which states that 30 to 35% cancer is caused by diet. Could you explain what is the possible mechanism? Definitely, firstly, an unhealthy diet, for example, a highly processed diet. It's also now known as the deadly American diet or the standard American diet, which is considered a deadly American diet, and we are fast following it. For example, we are having fast foods, chow mein, which is just maida, which is hardly having fruit, any vegetables, or for example, बिस्किट्स खा रहे हैं, केक खा रहे हैं, ब्रेड खा रहे हैं, आजकल जूस पीने का इतना वो है. तो for example, rather than having, I'm not saying canned juice, even otherwise, rather than having a juice which is having the sugar of 6 mosammis or संतरों का, why not have eat that, because you'd have high amount of fiber, and it would have a much lower glycemic index, because you would just eat 1 or 2 oranges, and over the day maybe you'll eat few more. So this diet is highly inflammatory. For example, it's been seen that when you're having highly processed food, it's a highly inflammatory diet which is lacking antioxidants, with a diet which is having minimal amount of fiber. In addition to that, high intake of non-veg food, which has a lot of endocrine disrupting chemicals. It also lacks fibers, lacks antioxidants. All these factors, it's been seen, has an increase in the incidence of cancers. It's even been seen that people who barbecue meat, especially when you're even the fumes that you are breathing, the smoke, they have higher incidence of oropharyngeal cancers, nasal cancers. So diet plays a very important role, because unhealthy diet is associated with inflammation, oxidative stress, dysregulates the genes and leads to cancer. In addition to that, there are studies which have clearly shown unhealthy diet, obesity, high levels of inflammatory cytokines, oxidative stress, then cancer. So it's very, very important to understand that diet is a very, very major trigger which can actually switch on these genes. Initially, it was believed that cancer is because of certain driver mutations. And definitely, there are certain mutations which are highly penetrant. If you have mutations in those genes, you will develop cancer. But in rest of the cases, it's due to the changes in the epigenome. For example, environmental pollution, all those pollutants don't cause mutations. They actually cause changes in gene expression, and those changes in gene expression can then result in cancers.
I see a question, a generic question coming from Vivek Kumar Tiwari. He asks how yoga improves persons with neurological diseases.
Okay, so there could be number of neurological disorders. For example, let's talk of depression, which is which is a mind-body disorder. And we are treating, I want to emphasize here, first of all, that whenever you have a disorder, you should always be first treated by a yoga therapist. Firstly, you should determine what is the severity of the disorder. Mild, moderate cases may just be treated by yoga alone, but in later stages, when it becomes severe, you need to go and adopt yoga as well as contemporary medicine. A yoga therapist needs to actually gather your history and accordingly will tell you what is important, which part should be done, how much. For example, if there's a person with depression, if you make him just do meditation, his mind will start racing more. Rather, they should be told to do more active practices like asanas. So it's been seen, for example, in depression or in many other mental these health issues, it's been seen that our studies have clearly shown, and there are many studies now, yoga is increasing factors which are helping to bring about neuroplasticity. That means your brain is becoming more plastic, it is becoming more, it is responding to various stimuli. And studies have clearly shown that certain key areas of the brain, they show increased gray matter. For example, the prefrontal cortex, the hippocampus, the parieto-temporal cortex, the area which is concerned with stress, like the limbic, the amygdala, its size decreases. And this happens over a period of time. So we are able to better combat, and you are developed to these stressful stimuli. We are able to develop emotional resilience and grit. So this is how it is helping to promote neurogenesis. So for example, it's been seen, for example, in Parkinsonism. I've not worked on it, but I know that studies have clearly shown that in Parkinsonism, with the dopamine levels decrease with practice of yoga, the levels can increase. There is more regulation of motor activity. So because it helps to bring about neuromuscular coordination. So yoga is having a huge impact on our mental health. And it's important, like in modern medicine, we consider depression to be a disease of the mind. But every disease has an effect. For example, if you're infertile, you develop stress, anxiety, depression. Similarly, when you have a disorder of the mind, it affects the health of every cell in the body. And therefore, you need to be managed by an intervention which targets both the mind and the body.
So the Vivek Kumar Tiwari, would you like to follow up on the question? Okay, then I move on further. So there is a question coming from Konda VVS Krishna. The question reads, building on the discussion about epigenetics and long-term health outcomes, could regular yoga practice enhance telomerase activity and thereby slow down cellular aging? This is the first question coming from him.
See, telomerase activity is also higher in cancer cells, right? But the good thing with yoga is that not telomerase activity is increasing, but DNA repair mechanisms are also increasing. So you can slow down your rate of aging. As I told you, you slow down aging, you slow down, but not only aging, you slow down, but you improve your health span also. So your biological age is much lower than your chronological age. So that's why I was saying, rather than putting products or investing millions of rupees in research, like to buy products to look younger, you can actually stay younger and healthier for longer periods of time.
So Konda VVS Krishna, would you love to follow up on the question? And he has another question that reads, are there any recent studies linking mind-body interventions like yoga or meditation to improved neuroplasticity or reduced risk of age-related neurodegenerative diseases like Alzheimer's?
Absolutely, absolutely. This is a very good question. Alzheimer's and dementia, mind cognitive decline are on the increase. And yes, there are many studies. We've also finished a study, as I showed you, it showed, and we found that with practice of yoga, there was a decrease in the levels of these plaques, amyloid beta plaques, and decrease in the neurofibrillary tangles. And we've submitted this paper. It's been under evaluation for the last 7-8 months, and we are waiting for, but they've sent it to 6-7 reviewers because, these papers are looked at very critically, because in the West, they just can't believe it that yoga could be having such a profound role in the, on so many systems. We've also worked on LHON, which is Leber's hereditary optic neuropathy, which is also irreversible. And we found that in these cases also the deterioration in vision, it stopped, it declined. Otherwise, they progressed to become blind. So there was an improvement. So definitely, yoga is the answer for neurodegenerative disorders. It can be very well managed with neurodegenerative disorders. Now, when people have cases with Alzheimer's at home, there's also a huge increase in the caregiver burden. Those the relatives who are managing them are physically and mentally and emotionally exhausted. So we've done studies on the caregiver, and that the caregiver burden also significantly reduces in these individuals.
So I move on with the next question. A question coming from Sangeeta Kumari mentions, thanks ma'am for the session. She asks, I have C-section recently and gained weight and mother pouch. Which yoga will be best for me?
Ma'am, if you've had a cesarean, firstly, you should again, meet a yoga therapist who will advise you when to start practicing, because you would be having the stitches. So one should be careful. But definitely, if you start doing, the main reason why we gain weight is we start eating too much. We say, now we are 2, so we can eat double the amount. That's not right. The thing is, we actually start eating is our emotional eating, because we have under so much pressure, managing home, work pressure, child. We are emotionally eating more also. So that yoga regulates, and gradually you can start various yogic practices depending upon the yoga therapist who sees how healthy is your scar and cesarean scar. And then you start doing yoga practices, doing, it's not what you do the complicated asanas, doing simple asanas, but doing them regularly will help to tone your body and increase your fitness and decrease your weight.
So, ma'am, Sangeeta ma'am, would you like to follow up on the question? Okay, then I move on further. Dr. Amitabh Bishwas asks, is it possible that diet and yoga could pause or reverse cancer? And what are effects of fruits on cancer progress?
See, we've done work on cell lines. It's yet not published, but definitely yoga is going to enhance expression of genes which are helping to maintain integrity. But once cancer occurs and it has metastasized to different tissues, you really need to bring about a drastic change in your diet and lifestyle. And to actually gain a control, I would not like to comment whether you can reverse it, because some cancers are very aggressive and our studies are in a very preliminary stage. But doing it will help you handle the issue of cancer, how the emotional toll it takes, and you'll be able to definitely cope better and definitely be better off than people who do not do it.
So, Dr. Bishwas, would you like to follow up on the question? Okay, I move on further. It's not a question, but it's a suggestion or rather a request from Konda VVS Krishna. He says that if it's okay with you, kindly share the PPT in our WhatsApp group for the reference.
Okay.
Yeah. Okay, I move on to the next question. A question coming from Shweta Kumari. Can a female suffering from PCOD do all yoga asanas, or is there any restriction?
Ma'am, I think it's very important. Initially, when you start doing yoga, you should do it under yoga therapist so that they know all the other issues you are having. For example, there are certain asanas which are better, which will increase the pelvic blood flow, like the butterfly asanas, Yoga Nidra to decrease the stress. Surya Namaskar is very useful, but it is very important. First, do with a yoga therapist, learn which ones are important for you, and then only go ahead, because we have to see other comorbidities as well. If you just give a blanket statement, that may not be right here. Thank you.
So, ma'am, would you like to follow up on the question? Does not seem to be. Shweta ma'am has expressed her thanks. The next question coming from Dr. B. Minakshi Sundaram. Dear ma'am, what is your suggestion for psoriasis treatment through yoga?
Um, Ma'am, psoriasis is an autoimmune issue. And though we've not worked on psoriasis, but these autoimmune issues are precipitated by stress. And definitely, yoga can manage inflammation and stress. So, psoriasis is also increased inflammation, increased epidermal proliferation unit, increase activation of the epidermal cells. And with practice of yoga, definitely you can regulate the cell division. Though we've not worked on psoriasis, but definitely the inflammation, the rate of cell division would be regulated and better managed. And these conditions are precipitated when you have high levels of psychological stress that can be managed. So you could better manage this condition with yoga than without it.
Ma'am, would you like to follow up?
But I would have to read about psoriasis to tell you about more details of how yoga can act. But definitely there would be papers to tell you exactly how yoga would, benefit. But definitely I know this, that psoriasis is precipitated by people who have high levels of stress, and yoga can really manage that well.
Uh, I don't see any more questions popping up, but people have they have expressed their appreciation for you, ma'am. Thanks for your wonderful presentation.
Thank you.
And yeah, Swati, okay, thank you, ma'am. So I don't see any more questions coming up. So if anybody would love to come up with any, okay, there is another thing coming up. No, people have, yeah. Okay, so now let me take the opportunity to extend our appreciation for ma'am for this insightful talk. Thank you, ma'am. So please accept our e-memento as a token of appreciation. So please join me virtually to express our reactions for ma'am. So I just clapped for your wonderful presentation. So yeah, Kaleshwari has, thank you, ma'am, for the wonderful session. So if there are no more questions, then I take the opportunity to thank you once again, ma'am, for this wonderful talk. And please accept our e-memento from the organizers of Galgotia University.
Thank you so much. Thank you.
Yeah. Okay. So now we move on with our next speaker, who is Ashmit Verma. Yeah, I see Ashmit Verma on board. So, yeah, please join me to welcome Mr. Ashmit Verma for our in the FDP program. So, welcome, Mr. Verma, in the FDP, and let me give a brief introduction about Mr. Ashmit Verma. So, he is a biomedical engineer driven by a passion for healthcare innovation and technology. He has collaborated with several leading institutions, including IIT Indore, IIT Roorkee, IIT Delhi, IIT Madras, IIT Kanpur, and King George Medical University, Lucknow. He is a recipient of prestigious national honors such as the Entrepreneur in Residence Award from the Department of Science and Technology and the School of International Biodesign Fellowship Award from the Department of Biotechnology, Government of India. Ashmit is also the director of Well On Next Private Limited, a company focused on developing next generation wellness devices by blending modern technology with ancient wisdom. With a strong research background, he has authored multiple high impact publications and holds several patents. His work spans medical device development from ideation to commercialization, contributing significantly to both academia and industry. So it's our privilege to welcome Mr. Ashmit Verma to share his work on his journey. So please join me virtually to welcome Mr. Ashmit Verma. So, sir, the stage is yours. We are just trying to, yeah.
Yeah, now I think it's on. So, thank you very much for the wonderful introduction and inviting me to this wonderful faculty development program on the occasion of International Yoga Day. Also, I would like to thank Dr. Gaurav Kumar and Dr. Shlok Jindal for the invitation. Really appreciate it. So, can I share my screen now? Hello, I'm not able to share my screen.
Sir, can you share now? Please try again.
Yes, it's now. So, is it visible to all?
Yes, it is visible.
Okay. So, the topic that I will touch on today is something on which we are working for about half a year, 1.5 years now. We started working on this area in 2024 in the early January. So currently I'm working as a biodesign fellow at IIT Kanpur and KGMU Lucknow. So this is a very unique program in which you are the engineers like myself are get the chance to go in the medical in the hospital setting, identify the urgent unmet clinical needs and develop some solutions on that. So while doing our immersion period at KGMU Lucknow, we went to psychiatry department. There we saw that the patients who are suffering from depression, anxiety, or stress are generally referred with a breathing protocol along with the medications. But the problem with this approach was that we saw a very low compliance rate in this. The problem was KGMU has a very high patient burden, and doctor teaches the breathing protocol to the patient one time and then the patient goes to their home. They perform it once or twice. After that, they, because of lack of guidance or they forget how to do it, they stop doing it, because of which the results does not come out that much good. So from there, the idea originated to develop the interventions, especially breathing intervention for this medical wellness area. That's why we are the topic of today's talk is how we can combine the breathing intervention with mental wellness and give this to people to so that they can apply it to their daily life. So the topics that I will be covering today will be how mental wellness matters today. What are the science behind the breath work or the pranayama? How people are not doing it correctly, and how the breathing as a work as a bridge between mind and body, and what we do at VeloNext and what we are going to do in the future. So why mental wellness matters today? The published data suggests that there are almost 300 million people worldwide living with depression. 275 million people worldwide are living with anxiety disorder. Combining all these, there is a loss in productivity due to common mental wellness issues every year, which is around 1 trillion USD, which is a huge number. And if we talk about India, there is a treatment gap for common mental disorder, which they attribute to lack of awareness and access to psychiatric services in India is around 85%. Quote unquote, this tells us that around the globe, 1 in 8 suffers from mental health crisis at some point of life. We all do. You might be stressed at some point of time. You might be in depression state. There is another interesting graph that is on the right side of the slide, where there's a combination of the burden of different diseases around the world. And there is a very famous quote written in below. Put on the global scale and all significant diseases combined, mental and behavioral disorder account for the largest portion of global burden of diseases, which is over 22%. And this burden is increasing each year. So it's not like that there are not solutions available in the market. There are multiple solutions. For example, there are meditation app, AI chatbots, virtual therapy, online communities, smart wearables. But most of these solutions struggle with a common problem of low compliance and reliability. What we are doing is we are addressing this issue by introducing a smart wearable for easy mental health care. Now, before I move on to the study we have done and the work we have done till now, I would like to introduce everyone what is breathing and how it has been overlooked throughout the time. So breathing is an autonomic function, yet highly modifiable. So we all breathe. We cannot live without breathing for maximum period of 3 minutes. But uh, very few people knows that it can be controlled and modified as per our will. It acts as a bridge between body and mind, often ignored in conventional mental wellness approaches. So we did a survey among different hospitals, nation level hospitals, and we found that around 50% of the hospitals or the clinician suggests a breathing protocol along with the medication, but 50% does not. So this means that they in the uh, within the medical settings as well, there is a awareness needed for this approach. What are the different benefits of breathing? It improves the oxygenation, better respiratory function, enhanced physical performance, better mental and emotional well-being. Now, since I've been telling that people does not breathe properly, we are not breathing in the right way. So then what is the proper breathing? So the next there is a 2-minute video ahead. This will show you that how we are breathing not in the right way and how we should breathe. So I hope you like it.
Mr. Ashmit Verma, we are unable to hear the sound of the video. Mr. Verma? Am I audible, Mr. Verma?
Oh, I'm sorry.
We are unable to hear the sound.
So I hope you liked that video. Sorry for I restarted it one time. So the lady is trying to tell that when she basically told us what is diaphragmatic and shallow chest breathing. So usually we should do this deep breathing, which is by the movement of diaphragm. The breathing occurs by either lengthening or shortening the chest cavity or expanding, contracting the chest diameter. So the deep breathing involves vertical chest movement using the diaphragm, drawing air deep into the lungs. Abdomen expands and contracts while the chest remains mostly still. But what we usually do is shallow breathing. It involves horizontal chest movement, chest expansion using intercostal muscles. Air stays in the upper lungs with visible chest movement and often paired with mouth breathing. So when you are breathing deep, you are actually breathing through your nose. Now there is one more comparison which can be done here based on this, which is nose versus mouth breathing. So mouth breathing has limited benefits and notable drawbacks. While helpful when nasal passages are blocked or quick airflow is needed, it bypasses nose filtering, humidifying function and may stem for congestion and anatomical issues or respiratory condition. While a nasal breathing enhances air quality and circulation, it humidifies the air, it warms the incoming air, produces nitric oxide for better oxygen transport, and reduces hyperventilation risk. Nose breathing also supports health and comfort. It protects oral health, prevents dry mouth, sore throat, and bad breath, and guards against sleep apnea and jaw facial issues like mouth breathing. This figure on the right will show you how this last line, what this last line signifies. So when you're breathing through your mouth, nose, a proper alignment of the upper and lower jaw happens. Alignment of the teeth becomes normal. Facial height and mandibular plane angle within the average range, and just the opposite happens when you are doing breathing with your mouth. So the problem is that most of us are not breathing right. We are doing what we call shallow breathing, breathing through our chest, which reduces the oxygen level in our lungs and increases anxiety. This is due to the fact that we are living in a fast-paced society. Our lifestyle is fast-paced. That's why we are over-breathing. Constant stimuli trigger rapid unconscious breath. This causes stress, which is a sympathetic overdrive. Shallow breath keeps the body in fight or flight mode. This results in fatigue or brain fog, poor oxygen and CO2 balance, impaired focus and mood. So all of this creates a cycle. So first you have stress, then you start doing shallow breathing, which creates more stress, which results in poor performance, and poor performance again results into stress. And this cycle keeps on running. And there is a stat that says that 90% of people are breathing incorrectly on a regular basis. Even I used to breathe incorrectly until I recently came across this study. So how can this problem be solved? Pranayama is an ancient yogic practice focused on breath regulation to control and expand vital energy called prana within the body. This is a science which has been passed down to generation in our Indian knowledge system, and which tells us, which teaches us how to breathe properly, how to control your breath. It involves various breathing techniques aimed at achieving physical, emotional, mental, and spiritual well-being. The word pranayama is derived from two Sanskrit words. First part is prana, which means life force or breath. The second is ayama, which means control or expansion. There are several pranayams that we see in our day-to-day life. Very famous one is Sudarshan Kriya, which is a combination of three yogic protocols. First is Ujjayi, then Bhrastika, and third one is Om chanting. And it combines breathing practices are derived from 5,000-year-old yogic science of breath. Some other famous breathing practice breath work that is Anulom Vilom, or known as alternate nostril breathing, Brahmari, bee breathing, Kapalbhati, skull shining breath. So there are a large amount of studies that is happening recently and has been done previously as well, which are showing the short-term effect and long-term effect of pranayama on people. For example, this paper published in Nature, it shows how slow respiration rate is associated with high self-reported well-being. Means they did a study for 4 weeks where they asked their participants to do slow respiration, and after the completion of the duration, they found out that they are reporting better well-being. Means they are less anxious, less stressed, and feeling calm and more happy. Similarly, there are other studies on different yogic pranayams published every now and then now. So what are the daily benefits of breathing, right? In both short-term and long-term impact. So when we are talking about short-term, you will get the immediate stress relief. For example, if you are doing Anulom Vilom for 15 minutes, you will get the immediate stress relief. Reduction in heart rate and blood pressure. This is because slow breathing enhances vagal tone, calming cardiovascular functioning. Improved concentration and mental clarity. Breath awareness reduces mind wandering and enhances attentional control. If we see what studies has been done to identify the long-term benefits, then they found that emotional resilience and improved mood. So regular breath work is linked to reduce anxiety and depression symptoms through autonomic regulation. Neuroplastic changes. Consistent breathing practices like pranayam and slow diaphragmatic breathing can promote changes in brain structure function, especially in the prefrontal cortex, insula, and limbic system. Improved heart rate variability. So heart rate variability is a very key biomarker when we are studying about stress and anxiety. It generally showcases whether you are in a stressed state or a calm state. So let's understand it a little bit. So heart rate variability is generally the RR interval between two heartbeats. So when you have low HRV, it means you are in a fight or flight mode. You get easily exhausted, low adaptability, decreased cognition. When you have high HRV, it means you are in a rest and digest state. You have improved performance, high adaptability, improved cognition. So why it works? Why this breath works have a influence on all these key biomarkers and mental state. So breathing influences the hypothalamic pituitary adrenal HP axis, down regulating cortisol and other stress hormones. It strengthens vagal efferents to brain regions involved in emotional regulation, helping the body learn to recover faster from stress. Now we will understand how breathing influences the nervous system. What is the mechanism behind it? So slow breathing is equals to parasympathetic activation. There is a paper published here. So in this study, they found that breathing at 6 to 10 breaths per minute reduces sympathetic activity and promotes parasympathetic calm. Vagus nerve gets activated. Deep rhythmic breathing stimulates the vagus nerve, a major regulator of heart rate, digestion, and emotional state. Enhances vagal tone, lower inflammation and heart rate, modulate the hypothalamus and amygdala. Now, there is one more interesting topic I would like to touch here, which is still many people are trying to do research on, is the nasal cycle. So nasal cycle is a natural alternating pattern of airflow between the left and right nostril, occurring every 90 to 120 minutes. So some research says that it changes every 60 minutes, some says it changes at 90, some says it changes at 120. But it is found that nasal cycle changes in a particular duration of time. This cycle is regulated by the autonomic nervous system and reflects underlying psychological states. So, left nostril breathing generally activates the parasympathetic nervous system, rest and digest, associated with calming, cooling, and reduced heart rate, reduces blood pressure and anxiety. Right nostril breathing activates the sympathetic nervous system, increase the heart rate and body temperature, and can enhance alertness and focus. So the pranayams like Anulom Vilom or alternate nostril breathing create symmetry in brain activity in autonomic tone. Means this pranayam can be used to regulate your nasal cycle, your left and right nostril breathing. So here is an video. It's a little bit long video. It's of 8 minutes, but it will give you the whole concept of nasal dominance, how it affects our daily life, and how we can regulate it.
Sir, Asmit sir,
Yes, yes,
the
yes.
sir voice is not coming of
Oh,
Sadhguru. So, sir, can you please reshare your PPT? And during the sharing, there is a button. You have to check in that button for the
okay,
sound sharing, system
okay,
sound sharing. Then it will be play and sound will come.
okay.
Okay.
Just a second.
Sir, you just stop sharing.
Yeah,
Do stop sharing.
I'm looking for that button. I cannot see it. Just a second.
Okay. First, sir, you have in the upper side, you can see one button, stop sharing. Go to the upper side, take the cursor upper side, sir.
Okay, okay. Yeah, I got it. I got it.
Yes. Now, when you will do sharing,
Yes,
just click on the share button. When you will click on the share button, the right side, you can see the share sound button.
okay, okay, okay.
So click on that share sound, then click on share.
Okay, sure, sure. I hope it works now.
Many of us, we don't notice it.
Is it working now? Hello?
चार बजे भी फिर कैब का चक्कर रहता है। हाँ तो बीच में अभी सीख हाँ
Are you facing any difficulty, sir? Asmit sir, you are muted. Asmit sir, you are muted. Sir, if you are facing any difficulty, please let me know. I will help you.
Hello, hello.
Yeah,
Am I
yes,
audible?
sir. You are. Yeah, you are
Okay,
audible,
now
sir.
I got it. I got muted. So yes, I'll reshare my screen.
Yes, sir. Yes, sir. When you will do share, no, sir, just click on the share button.
Yeah.
And when you will click on the share button, do not share your screen. Before sharing your screen, there is a option of share sound.
Okay.
So you
So
have to check it.
is
First,
it
we
coming
don't
now?
Yes,
notice
sir.
it.
Yes, sir.
Okay.
At sunrise, if you see, your breath will change. If it was left, it will go to right. If it is right, it will go to left. When you breathe through the right nostril, your metabolism is twice as much as it is with the left. Sleeping on the left side, your sleep will be better. Our breath changes in the nostril. 1 hour cycle our breath has. For 1 hour, it goes to the left, then it changes to the right for 1 hour. And it is aligned with the universe, with the movement of sun, moon, stars and everything. At sunrise, if you see, your breath will change. If it was left, it will go to right. If it is right, it will go to left. Observe during sunrise. And sunset, again it happens. Your breath changes nostril. When you breathe through the right nostril, your metabolism is twice as much as it is with the left. That's why the right nostril is called the sun. Sun is more powerful. Left is called moon, whereas your metabolism is half. When you breathe through the right nostril, your left brain is functioning. And when you are breathing more through the left, your right brain is functioning. Left brain is logic. Right brain is music. If your left side is functioning more, you are able to understand me better. When your right brain is more active, you are listening to it like a music. You don't bother to think, analyze like that. When both nostrils are functioning, that's when meditation happens. When the balance happens, right and left brain activity gets balanced. When the right nostril functions, that is when you must eat. Your body signals you when you should eat. There's a secret to it. The right nostril functions, your metabolism is high. When you eat at that time, the food gets well digested. Right nostril eat, and drinking in the left. What we do usually, we eat and drink at the same time. Why? Because the solid food gets digested with the stomach juice, the gastric hydrochloric acid in your stomach. When you drink, what happens? The juice gets diluted. Then your food doesn't get well digested. Undigested food remains and becomes what is called in the Ayurveda called ama. Ama means a sort of something that harbors not so friendly bacteria. When you have to eat food, right should function, and after half an hour, 1 hour, you can drink. You can have soup, you can have anything, but not just plain water or Coke or all those aerated drinks immediately after food. There's a couplet in Sanskrit in the Ayurveda that says water before food a little bit is good for digestion. In the middle, it is good for digestion. But in the end, it creates toxins in the body. Bhojanante vishapvari. At the end of the food, if you drink water, it's going to make it toxic. Slow toxicity will develop in the system. So when you should drink, either 1 hour before meal or when you have had a full meal 1 hour later. By the time all the gastric juice, everything mixes with the food and they start to digest the food. Salad and water or any aerated juice is a no, no, no. You eat salad and then you have Coke or something. No good. When you are in the toilet, if the right is functioning, then your bowel movement is clear. But if you are in the toilet and the left is functioning, within 3 hours you have to go back again. You have to go and clear it again. Now sleep also. Which side do you sleep? Left side. That's better. Your sleep will be better. Sleeping on the left side. When you lie down on the left side, the right nostril will start functioning. This is the healthy habit. Many of us, we don't notice it. If you sleep on the right side, you have vivid dreams. You get deep sleep. And you wake up, you still feel tired. You can change sides. But say about 50%, 60% of the time you should sleep on the left side. This you can do even after a meal. But if you have had a meal, you try to sleep on the right side, you can't. Many people say, eat much before you sleep because you tend to sleep on the right side and then the food gets into your esophagus. You feel burping, you feel uncomfortable. But if you sleep on the left side, even after a meal, suppose you had a late dinner, it doesn't affect you badly as much as it does on the other side. Suppose the breath is not changing and you are on a dining table, you have to eat, what to do? Have you seen this ancient rishis and they used to keep a stick to their side? You know why they keep it? So that the breath changes, remains in the left side. So you can meditate long. So what you should do is just put your fist under the opposite side and press it. If you press the left side, the right will function. Okay, never mind. If it not happens all the time, never mind. Try to follow as much as possible. If you have noticed, the moment I walked in, both would have happened. If the teacher is real, you just look at your nostril, both will function. If you happen to be driving and if you pass by a place of worship or a place where people are meditating, suddenly both nostrils will function, even just for 2 minutes. And if you are passing by airport, also it happens. Because the prana or the breath does not know difference between temple and an airport. Because airport uplifts your body, temple uplifts your spirit. And whenever you are working and both nostrils are functioning, and if it's not Wednesday, then it is better to be quiet. At the time you talk, do any action, it's not going to be okay. How do I do this all the time, keep watching my breath? No need. It will naturally happen when your mind is calm, serene, pleasant and happy. And how can you do that? Through your practices. Breathing, pranayama, meditation, all this will help. So knowledge in the right, music in the left, and when both meditation. So these are some practical wisdom.
I hope everybody enjoyed that video. So it gives us the idea uh, that how left and right nostril changes and how it affects our daily day-to-day activities. And I had the privilege to meet Shri Ravi Shankaracharya at IIT Mandi recently, and there also we discussed what we are doing at Velo Next and how it can be be useful in the research in their center. So what do we do at Velo Next? So our approach is to follow the science of pranayams, breath work, and how it can be used as a therapeutic intervention for mental health. I have showed you the research and the work that previously people have done, scientists have done, that it shows both immediate and long-term effect if practiced with a structured approach. But the current method to adapt breathing intervention include physical and online training and wellness center, mobile app, YouTube videos, etc. Despite its benefit for mental health, many struggle to adopt breathwork due to lack of awareness and consistency, leading to low compliance, negligence, and poor outcomes. So what we are doing is we are developing assessment tools for the scientific research around the Indian knowledge system first. And the first target that we have chosen is the pranayams, how we can help and how we can develop assessment tools to understand the effectiveness of pranayams. And we did a pilot study on this. First, we developed a assistive breathing device which can give real-time biofeedback and analysis, paired with a mobile app and a web application. So the mobile app and web application is used as a indicator and a way to see the results of the pranayams after they perform, after they finish their exercise. It gives them the real-time monitoring. So the breathing device feeds the real-time data into the mobile app and the web application. And then it provides assistance and supervision, how you should breathe. It gives you the cue where when to inhale, when to exhale. It is user friendly. We tested it with people. People are finding it for now user friendly. And also we have integrated the HRV device for another second biofeedback, which gives us the state of the person, whether the person got relief or is in stressed state or anxious state, or it came to calm state. It gives post-session feedback, how the breathing breath work, how was the breath work that the person performed. We did testing and validation at IIT Kanpur, and we are also moving to clinical settings. So initial research protocol that we developed has been tested, and a pilot study on 100 participants is going on at IIT Kanpur. So this is our approach. This work we also presented recently at the conference. So what we did, we divided the participants into two groups. First group we called the control group, where the participants are told to do normal breathing, means they are not told to do any type of exercise, just they have to sit comfortably and in a relaxed state and breathe as they breathe normally in their day-to-day life. Also, we took a STAI, means State Trait Anxiety Inventory survey. This is a set of questionnaires which is a standard survey used to identify the state of a person, whether the person is at stressed state or calm state. It gives like a score. So if the score is high, means the person is stressed. highly stressed, which is bad. And if the score is low, it means the person has stress level has came down. The second group was the pranayama group, in which we told the participants to do the Anulom Vilom exercise. And throughout the session, we measured their HRV. So the breathing device is put here on in front of the nose, and HRV device, which is a ECG based chest strap, which is placed here on the chest. And here are the results. So as you can see in the comparison of stress level among group A and group B participants, we can see this is pre and post session. So we can clearly see in the control group, even when they are not performing any type of exercise, the stress level came down. And in the group B participant, where they perform the Anulom Vilom, we can also see the stress level came down. And we can see the HRV trend among group B participants as well, which performed the Anulom Vilom exercise. So we took the first baseline here, and then the first session happened. So if you remember, high HRV means the person is in a relaxed state, which is good. And low HRV means the person is in a stress state. So the Anulom Vilom is of 15 minutes in a set of 5 minutes of Anulom Vilom, 2 minutes of rest, 5 minutes of Anulom Vilom, 2 minutes of rest, which is done 3 times. So in the first session, we can see the HRV increased. Then in the break time of 2 minutes, the HRV again decreased. Then again it decreased while during the break, and in the third session also it increased. And during the post session, it decreased. Now, the hypothesis that we are making here, I will tell it later why this happened, why after post session it decreased the HRV rate. I'll tell you later. Now, let's look at the breathing patterns. So, this is the breath rate and the breath amplitude. So, in the first session, we can clearly see the breathing rate is in the normal range between 8.5 to 10 breaths per minute. And as per the Anulom Vilom, it is meant to be at 7.5. So, which is, I think, good, given the fact that we did not told them when to inhale and when to exhale. We told them you have to do Anulom Vilom. We taught them how to do it, and they did it themselves. Similarly, in the amplitude, means how deeply they inhaled and exhaled, is shown here in the second graph. Here also you can see in the first session, the amplitude is quite good, but it decreased in the second and third session. So what does this prove? So our experiment was planned to prove the following need statement: to develop a wearable device for breathwork that enables effective and consistent practice of yogic breathing protocols, and to investigate the effect of breathwork in reduction of stress and anxiety levels. And in conclusion, from the results that we got so far, which is a result of only 20 participants, the study highlights a clear need and usability for a breathwork monitoring device for personalized and accurate practice of breathing protocols. So clearly you can see here, while performing the breathing first time, while they are performing the breathing protocol for the first time, for first 5 minutes, they show good results. But as they did it by themselves without any guidance, the condition deteriorated. Their breathing rate increased, their amplitude decreased. So a 15-minute Anulom Vilom session shows promising effect in reducing the stress and anxiety, especially when practiced with proper guidance. So that's why people do this Anulom Vilom in a long-term fashion. Why? Because I'll show you. So in the middle of the session, some participants felt fatigue. This is because they were doing this for the first time and were not habitual. So when you are doing a pranayam such as Anulom Vilom for the first time, it is obvious that you will feel fatigue. Even when we do some physical exercise, when we start doing running, we in the first few days we feel fatigue. We don't give our full performance. So this means a long-term study is needed to further prove that this HRV will be increased. In our experiment, we also clearly saw the nasal dominance shift as the participant performed Anulom Vilom for 15 minutes. So in research, it is told that it changes in 60 or 90 or 120 minutes. But while performing the Anulom Vilom, we saw in some participants that the nasal dominance shifted from left to right. Although results are not fixed or proven, it gives an idea that more investigation is needed in this topic. So this is the work that we have done. Now I have a small video, since this is on the occasion of International Yoga Day. So I would all of you like to see this video and learn how to do even a single pranayam properly. What are the things that need to be followed while performing a pranayam, and how it can be done effectively. And if you do it every day for a set period of time at a fixed time period, then you will see the effects. So I hope you enjoy this video.
नाड़ी शोधन को अनुलोम विलोम प्राणायाम के नाम से भी जाना जाता है। इस प्राणायाम की मुख्य विशेषता है कि ये दाएं और बाएं नासिका छिद्रों से क्रमवार श्वास प्रश्वास को रोककर या बिना रोके किया जाता है। नाड़ी शोधन को करने के लिए सबसे पहले आप सुखासन में बैठ जाएं, जो कि एक ध्यानात्मक आसन है। सुखासन के अलावा नाड़ी शोधन दूसरे ध्यानात्मक आसन जैसे पद्मासन, स्वस्तिकासन या वज्रासन में भी किया जा सकता है। जो जमीन पर बैठने में असमर्थ हैं, वे कुर्सी पर बैठकर अभ्यास कर सकते हैं। सुखासन में बैठते समय सुनिश्चित करें कि आपका मेरुदंड सीधा हो, सर ऊंचा, दोनों हथेलियां घुटनों पर और आंखें बंद हों। अपने मेरुदंड को सीधा रखने में आप दीवार का सहारा ले सकते हैं। अब कुछ गहरी सांसें लेकर शरीर को आराम की स्थिति में लाएं। नाड़ी शोधन का अभ्यास शुरू करने से पहले आइए अपनी उंगलियों की पहचान कर लेते हैं। अंगूठा, तर्जनी, मध्यमा, अनामिका और कनिष्ठा। अब अपने बाईं हथेली को ध्यान मुद्रा में लाने के लिए अपने अंगूठे और तर्जनी उंगली को आपस में छूकर एक गोले का आकार दें और अपनी मध्यमा, अनामिका और कनिष्ठा उंगली खुली रखें। अब दाईं हथेली को नासाग्र मुद्रा में लाने के लिए मध्यमा और तर्जनी उंगली मोड़कर बंद करें और अंगूठा, अनामिका और कनिष्ठा उंगली खुली रखें। अब अपने दाएं हथेली के अंगूठे को, जो कि नासाग्र मुद्रा में है, अपनी दाईं नासिका छिद्र पर रखकर नासिका छिद्र बंद कर लें और बाईं नासिका छिद्र से सांस भीतर लें। फिर बाईं नासिका छिद्र अनामिका और कनिष्ठा उंगलियों से बंद कर लें और दाईं नासिका छिद्र खोलकर सांस बाहर छोड़ें। अब अपनी दाईं नासिका छिद्र से सांस भीतर लें और उसे अंगूठे से बंद कर बाईं नासिका छिद्र खोलकर सांस बाहर छोड़ें। यह नाड़ी शोधन या अनुलोम विलोम प्राणायाम का एक चक्र है। ऐसे 5 चक्र दोहराइए। प्रारंभ में सांस लेने और छोड़ने में बराबर ही समय लगेगा, लेकिन सांस को बहुत ही धीरे धीरे छोड़ने का अभ्यास करना चाहिए और कोशिश करनी चाहिए कि जितना समय हम सांस भीतर लेने में लगाते हैं, उससे दुगना समय सांस छोड़ने में लगे। सांस धीमी, स्थिर और नियंत्रित अनुपात में बनाए हुए रखें। नाड़ी शोधन का मुख्य उद्देश्य शरीर में ऊर्जा वहन करने वाली सारी नाड़ियों का शुद्धिकरण करके पूरे शरीर का पोषण करना है। ये हृदय रोगियों के लिए बहुत लाभदायक है। नाड़ी शोधन कफ संबंधित विकारों को दूर करता है। नियमित रूप से नाड़ी शोधन का अभ्यास जीवन शक्ति और एकाग्रता बढ़ाता है और तनाव तथा व्यग्रता के स्तर को कम करके शांति प्रदान करता है।
So I hope you enjoyed that video. Similarly, there are other breathing protocols as well. For example, box breathing is also another breathing breathwork that you can perform for immediate stress relief. So in this, you have to just sit comfortably with a straight spine and inhale through your nose for 4 counts, hold your breath for 4 counts, and exhale your through your mouth for 4 counts, and repeat this for 1 minute. And you will see that you are less stressed than before after performing this breath work. So I would also like to tell something about the collaboration that we have made till now. We are collaborated with Nimans Bangalore and Pause and Learn. Also with Miss Smita Kumari. She is a yoga expert at Adani Group, Ahmedabad. Dr. Rita Agrawal, who is a clinician at Memphis Healthcare, USA. And Dr. Shlok Jindal, of course, I know him since IIT Roorkee, since his PhD days. So this is our team. We have a team of highly skilled engineers and data analysts and neuroscientists. And our mentor pool also consists of people who are working in the field of behavioral science and psychiatry department. We have a mentor pool of great neuroscientists and doctors from both KGM Lucknow and IIT Kanpur. Our journey started in 2024 in January from clinical immersion. Then we did conceptualization, prototyping at IIT Kanpur, and currently we are at the validation stage and validating our product for future research. Some recent achievements were we recently got the first prize at IIT Mandi. Also, we have a couple of grants and we are applying for more grants and publishing our work in the future. So this is all from my side. Thank you, and I'm now open for question answers.
Okay. Participant, you can unmute yourself, and if you have any query, you can ask to our speaker. If anyone has any query, you can unmute yourself. Dipti, ma'am, please unmute yourself to ask the question. I think there is no question is there.
No problem.
But participants are very excited and they are providing their valuable feedback like great session, excellent and insightful session. Sir, Dipti ma'am, you can unmute yourself. I have given the permission to all the participants. They can unmute themselves. They can also start their video. Okay. Now, I would like to thank Asmit sir for accepting our invitation and delivering such an insightful talk.
Thank you so much.
And you have collaborated the vision of one yoga for one earth, and the Ministry of Ayush, UGC, recommended the 1 month yoga celebration program on the occasion of International Day of Yoga. So we are, the Galgotia University are very grateful to contribute to the ministry initiative for this International Yoga Day celebration. And we are very thankful, sir. You have accepted our invitation and conducted such an very wonderful and informative session. So,
Thank you so
sir,
much.
kindly accept this e-memento as a token of love and gratitude from the Galgotia University and from the organizer.
Thank you so much. Pleasure is all mine, and thank you so much for inviting me. And I hope we can surely collaborate again in the future with the Galgotia University. Thank
Yes,
you.
sir. Thank you so much, sir. Thank you so much, sir. So, I am requesting all the participants to kindly switch on their video for a group photograph. Only for 2 minutes, you can switch on your video for the group photograph with the speaker. And if you have any query, you can unmute yourself and ask. Thank you so much, everyone. Thank you so much, Asmit sir.
Thank you.
I'm also thankful to Rima Dada ma'am for accepting our invitation and for delivering this keynote talk on the occasion of this faculty development program. So we have another speaker with us after the lunch. So we will gather at 2 p.m. after lunch. So I am requesting you all to kindly join us at 2 p.m. to listen our next speaker. There are 2 invited talk from the Dr. Harsha Khandelwal ma'am and Viral Kumar Patel sir after post lunch. So thank you all the participants, respected teachers, faculty member who are showing their faith to register for this FDP, as well as they have joined from their time, valuable time. So you all are requested to kindly join the FDP, or you can be with us. You can leave the meeting, or you can be with us. We will start at 2 p.m. Sharply, we will start at 2 p.m. So requesting you all to kindly join at 1:50 p.m. Thank you all. If you have any query, you can ask. We will start at 2 p.m. And today we will circulate one feedback form. Your feedback will be very important to us, to kindly provide your feedback in the last session. Thank you all. Thank you. We will meet again at 2 p.m. Thank you, Asmit sir, once again. Thank you, sir.
Thank you.